Hello, hi everyone. How are you all today? Welcome to this live virtual clinic. Hope everyone is well. In today's chat, I'm going to be discussing coping with braces. Now, braces aren't the most fun thing. Hi, Sue. Braces aren't the most fun thing to go through, as I'm sure many of you can relate to, but the end result is definitely worth it. The first thing I want to say before this chat is that the content that you'll see in it and what I'll be saying is not intended to be personal, medical, or health advice. It's purely for educational purposes, and it's not intended to be a substitute for seeking professional dental or healthcare advice. For personalised advice, please do consult with your doctor, dentist, or healthcare provider. Now, the structure of today's clinic is going to be such that I'm going to start by saying a few hellos to everyone, and perhaps you can tell me whereabouts in the world you are. And we're then going to be discussing the topic of coping with braces, including what to expect at your fit appointment, how to deal with pain, excuse me, and diet adjustments and speech problems. I'd also like you to please prepare any questions that you may have in the meantime, because after the chat, I'll be going through your questions and hopefully answering any questions or concerns that you may have about braces. So I can see we've got a few more people with us today. So let's just say a few hellos before I start with the actual topic of today's talk. So we've got Sue Lalali there. Hi, Sue. In the UK. Prince of Zam, hello, hi to you. We've got Taylor, hi Taylor. And Prince of Zam is in Snaresbrook. We've got Valeria Rodriguez, and you're getting your braces next month, so you really want to learn. Fantastic. Well, you're in the right place, Valeria. Make sure you get any questions you have ready for me. Hi Taylor, and we've got Valeria. Okay, so fantastic. So let's start with the topic of coping with braces. So the first thing I want to tell you is that if you do have your braces appointment booked, and by your braces I mean fitting your braces, I want to reassure you a question that I'll often get asked actually from my patients before they have their brace fitted. So when they're coming in for their records, so they're coming in for their photos, molds, x-rays, and they've had their consultation, they're often quite apprehensive for the fit appointment, and they do wonder, is it a painful appointment? Is it painful to get your brace fitted? So what I'd like to do is just reassure you that having your brace fitted is not painful. We don't use any injections, so you don't get any anesthetic, we don't pull out teeth, no needles. It really is a painless appointment. It's pretty relaxing because you're lying on the chair for the good part of an hour, and you have the light shining down on your face. It really isn't painful. I often tell people, just imagine you're on a beach, because that's what it looks like. They're sort of lying flat, they've got the light shining on their face, and a lot of the time that people will actually fall asleep when they're having their brace fitted. It really isn't painful. So I just want to reassure you, if you're having your brace fitting appointment, don't worry, because it isn't painful. Basically, you can expect some mild soreness and discomfort when you have your braces fitted, and this is quite normal, because what happens is that the braces, obviously they go around the outside of your teeth. So I've just got a model here if you do have your brace fitting appointment. So here we can see that these are sort of the brackets. I don't know how well you can see this. And obviously the brackets go around the outside, and you have wires at the back, and it all connects up. So you can imagine that having this in your mouth can cause a little bit of soreness and discomfort, and that's quite normal. So don't worry too much about that. The soreness and discomfort that you do experience tends to last for everyone's different. So some people won't experience any pain, any soreness or discomfort, but for some people it can last for up to 2 weeks. And normally it gets better after that. I'd say if you're still experiencing that soreness and discomfort after 2 weeks, then you do need to see your orthodontist. So basically, after you've had your brace fitted, that they should do after they've had this adjustment. So I want to share these tips with you. So these are my 4 top tips to all my patients when you first had your brace fitted and after you're going in for your adjustments. So the first thing is to check your wire ends. Now, what I mean by this, if you've got braces, you'll know what I mean by this. But if you haven't got braces yet, then what I mean by this is that basically, when you have your wire fitted, so the wire goes around the outside of your teeth and it sticks to your brackets, and then here at the back, the wire connects into this tube, and sometimes the wire here can be a little bit long. So normally, obviously, orthodontists do cut the wire and they make sure it's short, but a good idea is to just check it at the end of every appointment that you have with your orthodontist. So whether you check it with your finger, just poke your finger in there and check to see if it feels long, or even with your tongue, just run your tongue along the back of the wire, check that nothing's digging in. If it is, make sure you tell your orthodontist at that appointment that it's long, because they can cut it there and then, and it'll save you coming back to get it cutted, because trust me, even just a millimeter of wire can be really uncomfortable. The next top tip that I'd like to share with you is to understand the next steps of your appointment and what the next steps of your treatment involve. So what I mean by this is, has your orthodontist given you headgear? Have they given you elastics to wear? Have they given you an expander? Have they given you twin blocks? Have they given you specific oral hygiene instructions? Have they given you specific diet instructions? So all of these are so important. It's really important that you listen to the final things that your orthodontist says to you after they've adjusted your brace, and that you take it all in, write it down if you need to. If you're having elastics fitted, then perhaps take a photo of how you're meant to wear the elastics on your phone. This is something I often recommend to my patients, is that if you're going in and you're having elastics and you think you might forget, and it's not uncommon, don't be shy if you've forgotten how to wear the elastics as soon as they've told you, because often when you're in that dental chair, you are nervous, and we fully appreciate that it's not a comfortable experience for many people. So don't be afraid to ask your orthodontist, sorry, I can't remember. Could you please repeat how it is that I need to wear those elastics? And if you need to, take a photo on your phone of how you should be wearing those elastics. Trust me, it does help. Front and the back, and it can really be confusing, and I fully understand that, so don't be afraid to ask your orthodontist about that. And the next thing is oral hygiene instructions. Your orthodontist may have noticed that perhaps your brushing isn't so good, or perhaps they've advised you to brush in a certain way or to use certain oral aids to help you brush. Again, listen carefully, really focus on the areas that you need to focus on for the brushing. Often it's above the brackets. So these are the areas that people most commonly miss when they're brushing. So what I mean by above the brackets is that here we have the little squares on your teeth, and here we have your gum. And it's this area here that people will most commonly forget to brush. And this is actually the most dangerous area to forget to brush, because your gums are up here, and it's really easy to get tooth decay and marks on your teeth if you don't brush this area well, and you can also get gum disease. And the same applies for the lower teeth underneath the brackets over there. So this is really the most crucial part that you really need to focus on brushing. The next topic I'd like to talk about are diet requirements. So what I mean by diet requirements is that when you have a brace fitted, the brace is essentially glued onto your teeth with it's a strong glue, but it's not super strong, because obviously we have to be able to remove it safely afterwards. So you do have to be a little bit careful with diet. And what orthodontists will often do is they'll give you a sheet explaining what sort of foods you need to avoid and how you should eat. So I will often tell my patients, there are certain foods you need to avoid, or be careful with. So hard foods like carrots, crisps, nuts, pizza crust, baguettes, steaks, chewing gum, all of these things you need to be really careful with. Now, that doesn't mean that you can't eat an apple. It doesn't mean that you can't have a steak. All it means is that you need to be really careful. So if you're going to have an apple, chop it up into small pieces and chew on it gently on your back teeth. Don't bite into the apple with your front teeth, because this will dislodge the brackets. And the more breakages you have, the longer your treatment will take. So some orthodontists even charge for broken brackets, but even if they don't charge, it does delay your treatment in progressing. So if your bracket's constantly breaking, then you're gonna have to go back. It's a bit of a hassle. Isn't applied onto the tooth, so the tooth isn't moving. So that's why it's so important, and why all your orthodontists will often emphasize, these diet requirements, because we don't like it when your brackets break, because it means that your treatment prolongs, which isn't good for you. And obviously we want your treatment to be as quick and as efficient and as safe as possible. Okay, so, and the final top tip that I often give my patients at the end of their adjustment appointment is to book your next visit. So after I finish, I know this sounds really obvious, it kind of sounds like an obvious thing to do, but you'll be surprised by the number of people that just walk out of the surgery and will forget to book their next appointment. So you do need to, after you finished your appointment, I'll often say to my patients, I'll see you again in another 6 to 8 weeks. And often this is the normal kind of time that most orthodontists will see their patients, every 6 to 8 weeks. So my patients will then head out to reception and they'll know that they need to book in their appointment for 6 to 8 weeks. Okay, so do we have any questions? Don't forget to write down your questions for me if you have any. So the next thing I'd like to discuss is your first few weeks in braces. So basically, after you've had your brace fitted, it can take about, the glue does set almost instantly. So it's a pretty quick setting glue. It sets with a blue light and you can eat pretty instantly, but it does take, I'd say 24 hours for the glue to fully set. So, you do need to be careful during that period about your diet. But generally speaking, so long as you stick to the list of foods that we've given you, then it's usually quite safe to eat. The next thing I wanted to show you is how to use orthodontic wax. Now this will be your lifesaver actually at the start of your treatment. So what is orthodontic wax? Do any of you have orthodontic wax? Do any of you use it? How do you find it? I'd really like to know. Please drop me a comment. So I don't know how well you can see this, but let me take it out of here. So this here is orthodontic wax. And basically this is usually vegetable wax. Sometimes it can be made of silicone as well. And all you do is you just tear a little bit of the wax off, you roll it up in your fingers, okay, get it nice and warm. Or if the end of the wire is poking, what you do is you make sure it's nice and dry, because the wax doesn't stick very easily if the bracket's wet. So you need to make sure it's dry, so use a tissue or some cotton to dry the area, and then you just stick it on like that, and it really just cushions your mouth, okay? So it stops your lips from rubbing against the brace. And the other thing you can get that I've actually come across is something called orthodonts. So I think Amazon sell these, and these are very similar to orthodontic wax. But orthodontic wax is just very convenient because it's something that orthodontic practices sell. Normally I think you can buy a packet for £1, so it's pretty cheap. Yeah, so that's how you use orthodontic wax, and at the start it is a bit of a lifesaver. Now, the next thing I'd like to discuss is how to deal with pain in braces. Now, pain is a really difficult thing when it comes to braces, because it's really common to obviously experience pain and discomfort with braces, and often that's the one thing that people dislike most about the braces. So they'll dislike it more than the appearance, the pain that comes with braces, especially if you're slightly older. So adults do tend to experience more pain than younger patients. So to help with alleviating the pain, I'm going to give you some of my top tips. So the first thing is to stick to soft foods for the first day or two. Now, soft foods, obviously they apply less pressure on your teeth, so you're less likely to experience the pain that the braces cause. It doesn't exacerbate the pain as much. So by soft foods, I'll give you some ideas. So you can have things like soup, mashed potatoes, yogurt, milkshakes, apple sauces, scrambled eggs, really soft sandwiches. All of these, they're just a lot softer, and they apply less pressure on your teeth, because if you think about it, the brace is already applying pressure, and if you're then applying more pressure with hard foods, then it will increase the pain. Your teeth have nerve endings in, so that's why you can actually feel pain when pressure is applied to your teeth, whether it's through braces or through hard foods. The next thing, for my next top tip for alleviating pain, is to use that orthodontic wax that I mentioned before. Yeah. If you do have some mouth ulcers, so mouth ulcers are quite common, especially at the start when you first have braces. With them with your tongue, avoid sucking them. So sometimes you get them on your cheek, and a lot of people play with them, and it just exacerbates the mouth ulcer, and it can actually make it worse. So you need to avoid playing with them. And acidic food and drinks can also exacerbate mouth ulcers. So if you are prone to getting mouth ulcers, then you need to avoid acidic food and drinks. Things like warm salty water mouthwashes. This can actually help with mouth ulcers. It keeps the area clean, and it reduces inflammation, and it will speed up healing. So a very weak salty mouth water solution will help as well. The next top tip for alleviating pain is to use over-the-counter anesthetics like Oragel. So Oragel is quite popular amongst people that have braces. You can buy it from most drugstores, and it's basically a topical anesthetic, and all you do is you squeeze out the gel and place it onto the gum of perhaps a tooth or an ulcer that's causing the pain and discomfort, and the anesthetic just relieves some of the discomfort topically. So it's very sort of a localized way of reducing pain. It doesn't reduce the pain in all your mouth unless you apply it to all of your mouth, but it does reduce the pain topically in a specific area. And obviously you can also use over-the-counter painkillers if your orthodontist says they're okay for you. So normally I recommend for my patients whatever you'd use for a headache is normally also okay for braces as well. Okay, so the next thing I'd like to talk about, please do give me your questions, everyone. I'm still, looking forward to answering your questions after I've finished. So the next thing that I'm going to be talking about is how braces affect speech. So basically, most of the time, braces don't really affect someone talking. When they're first put on, they can affect speech. But one study has actually shown, and this was quite a surprise to me when I did some research on this before, that 57% of people do experience some speech problems immediately after having their braces put on. So this is quite a high number. And this was a study by Pali et al. In 2016. But most speech problems do go after a few weeks, usually a maximum of 3 months. So don't worry too much if you do have speech problems with braces. It's not uncommon. If you are familiar with famous people that have had braces, so Gwen Stefani, I don't know how many people here would be familiar with the singer Gwen Stefani, but she had braces and she continued to sing with her braces, and she got on just fine. She didn't have any problems at all. And I myself have also treated singers and actors, and they've had braces as well, and they've got on with them just fine. So I wouldn't say that braces particularly affect speech. Yeah, so basically that was pretty much all I had planned to discuss with you today. We have spoken for quite a while, 20 minutes. So how have you found the talk? How have you found it? Let me know. I'm just going through your questions and comments. Okay, so Sulalali, is today's virtual global clinic about coping with braces? Hope everyone has their questions. Yeah. Prince of Zam, what's the best way to clean between my teeth with a fixed retainer? Okay, Prince of Zam, so very good question. So if you do have a fixed retainer, so fixed retainers, for those of you that don't know, after you've had braces, you do wear retainers at the end of the treatment, and you can get removable retainers or you can get fixed retainers, and you can get both. Now for me personally, if I am giving someone a fixed retainer, which is essentially a thin piece of wire that goes behind your teeth and stays in place, I will also recommend a removable retainer. So I don't recommend just one. I would recommend a fixed retainer with a removable retainer. If you're using a fixed retainer, the best way to clean it is with something called super floss or small TP brushes, so interdental brushes. I don't think I have any with me right now, but yeah, I mean, something like this would help, but you can get really fine brushes. I thought I had some, but I don't. But yeah, you can get very tiny brushes, and you just kind of stick them in between your teeth underneath where the wire is, and it just gets it really clean. And super floss is essentially normal floss, but with a threading, kind of a thick piece of plastic that you can thread underneath and in between your teeth to get underneath the fixed retainer, and that works really well for fixed retainers. So Superfloss and interdental brushes or TP brushes, they work really well for cleaning fixed retainers, and I've actually done a video on this, so if you want to refer back to some of the videos I've done. Okay, just going through your questions. Hi Neil, thanks very much for joining. Hi Sue. These are amazing top tips. Thanks so much, Prince of Zab. I'm glad that you found this useful. My wire killed me. Oh, I know. I had braces as an adult as well. And trust me, I remember how bad it was. Really uncomfortable. So I think food is the most important. We had lots of breakages from food. Absolutely. Breakages from food is the most common thing that happens. Good idea. Baby's diet is good to adopt to stop having problems. Yeah, it's a good idea, definitely. I ate so much orthodontist wax. Yeah, I mean, they say it's made of vegetable wax, so I think it's safe. That's what yeah, we know anyway. So don't worry too much if you do swallow it. Hi, Dr. Khaled Sadek. So thank you so much for joining. I'm looking forward to watching your chat soon and your video soon. Okay, what else do we have here? So, hi doctor, I asked you before to talk about the sequence of arch wires used in orthodontic treatment stages and about Invisalign in detail. So the person that wrote me this comment, are you an orthodontist? So this is obviously, that's quite a big request because talking about the sequence of arch wires, that's essentially discussing how I do the treatment. And for me to discuss that even in one video is a little bit tricky because for me to do a good job and to explain why I use each arch wire for each stage, obviously that's something that we get taught in university over 3 years. So for me to discuss that in a video is quite an ask, but let me have a think about it and see what I can do. I can certainly talk about Invisalign in detail. That's fine. Dr. Sadek, I'll be online soon. Fantastic. Valeria, my orthodontist said they need to put a bite plate. What is that? And what is it used for? I also want to know the process of putting it on and all that. So, a bite plate. Valeria, could you let me know a little bit more about what your problem is? Is it a removable plate that they want to put on? Do you have some teeth that are tipped back? Perhaps that's the problem. So sometimes we use these if somebody has teeth that are tipped back and we want to push them forwards. Then we put a bite plate to disclude your bite slightly, and then we put springs on the plate to push some teeth forwards. So that's most common. We take a mold of your teeth, and then 2 weeks later we will fit the bite plate, and you'll wear the bite plate depending on your problem. Can be up to 6 months. Yeah, and then usually after the bite plate treatment, you will then have the fixed braces. Caroline Steed, you have the sweetest and most soothing voice. Thank you so much, Caroline. That's very sweet. McKinley, I don't know what colours to get. I want to get Halloween colours, but I have a power chain on the front 4. I don't know what colours to do. Well, my Halloween colours are orange and black. So this is the most common request that I get for Halloween, orange and black. So I'd say they're pretty good Halloween colours, orange and black. Sue Lalali, very good global virtual clinic to much help. It was very helpful. Thank you so much, Sue. And the other thing I'll say that McKinley, who has the power chain on, don't worry if you do have power chain, because you can often get elastics put on top of the power chain. Hi, Dr. Umang Tripathi. Very nice to see you here again. Hi, Margaret. Hope you're well. Hi, Neil. So the top eating tip from my ortho was it's not what you eat, but how you eat it. No breakages during my treatment. Now that is a fantastic tip from Neil there. So I completely agree with that. And yeah, you're right that it's not what you eat, but it's how you eat it. And he can testify to that because he didn't break any brackets. So that's a very top tip, and I do agree with that fully. Margaret Brace, thank you, Dr. Sarah. You have a good manner online. Thank you, that's so kind. Valeria, they said I have a very large overbite, and they said the bite plate isn't removable, I think. Okay, so maybe Trying to think what that could be, why they would use a bite plate. If you have a large overbite, yeah, I mean, it could be used for different reasons, and it's not removable. So it could be used to help push your lower jaw forwards. It might be some kind of device to push your lower jaw forwards, or to reduce your overbite as well. So sometimes we use them to reduce an overbite. But yeah, what you could expect is that you'd go in, you'd have the molds taken, and then 2 weeks later, normally they'd fit the appliance. So hopefully that helps. It's really difficult for me to comment on some of these, obviously, without seeing your case and knowing exactly what's happening. We've chatted for quite a while. I wanted to kind of show you a few more props actually, but I don't know, I'm not sure what else to show. So this here is a typical kind of orthodontic bracket. So if you have what we call the ligating brackets or self-ligating brackets, then your bracket will often have a gate, so it opens and closes, and then the wire goes in, and then normally you don't have the elastic. So that's most common with Damon braces, or you can get the ones where we use a small coloured elastic to go over the top, and these are the more kind of standard braces. Okay, so I think final comment I'll discuss is, do you think that an orange power chain or a green power chain would look good? I think I was gonna go for one of the power chain colour on the back of the teeth, like purple. Yeah, purple is definitely a good colour. You know what, don't worry too much, experiment. These don't stay on your teeth forever, but yeah, I'd say all of those colours, orange, green, purple, they're all really popular, especially during Halloween. Good luck with it. So I'd like to thank everyone for joining. Thank you so much. It's been an absolute pleasure chatting to you all tonight. I hope everyone is well and keeping safe, and I hope to see you all again at the next chat. And yeah, hi Sarah, I've had a braces. Are those my teeth going back to how they were for braces? Do you think I will need them again? Possibly, that's possible, Curly. You might need braces again, so I'd recommend definitely booking in with your orthodontist. Do you know any books related to Damon bracket system? I'll get back to you on that, Dr. Umang. I can't think of anything off the top of my head. McKinley, yeah, thank you. Very interesting chat. Thanks so much, everyone. Take care, and I'll see you again soon. Bye-bye. Hang on. Oh. Oh. Sorry, I don't know how to close this. 1 second. Oh dear. Oh. Bye everyone. I don't know how to close this. Oh dear. Okay. Sorry. Yeah, I'm still on. I know. I'm just figuring out how to close this. I actually have no idea. This isn't closing, but you're welcome to. Bye, everyone.